Hello students, today we will discuss about the muscles of the superficial perineal pouch. So in this heading you will have the three names: ischiocavernosus, bulbo spongiosus and superficial transverse perineal muscle. So whenever you are reading this topic, muscles of the superficial perineal pouch, or you have the question in exam, you have to mention these three names. So let's discuss about the muscles of superficial pouch. So the superficial perineal compartment located in the urogenital region deep to the skin, fatty layer and Colles fascia. In my class of the introduction of perineum, I already told you that how to differentiate the superficial and deep perineal pouch. Now, when we are talking about the superficial perineal pouch, you have to first look for that you are having this anteriorly placed urogenital triangle and posteriorly placed anal triangle. Now, when we are talking about the muscles of superficial perineal pouch, we are actually talking about the muscles which are present here. Clear? So, this is the one thing which you have to understand, that what do you mean why the muscles of superficial pouch and where will you find. So, superficial pouch lies just below the skin. Now, in this diagram you can see that this is your skin of the scrotal area and here you have the Colles fascia. Now, this Colles fascia will go and it will attach on the posterior side of perineal membrane, and this gap which is now present here is known as superficial perineal pouch. They are three pair of the muscles in the superficial compartment. Now, why we are using the word pair? Because these are the right and left muscles. So, you will have the right and left group of superficial transverse perineal muscle, bulbo spongiosus and ischiocavernosus. So, these are the six muscles which are known as superficial perineal pouch muscles. So, the superficial transverse perineal muscle, when you will see the three muscles, the superficial transverse perineal is most posteriorly located horizontally placed muscle in superficial perineal pouch. Now, here in this image, if you will see, this is your posterior border of urogenital triangle, and this posterior border is demarcated by the posterior margin of your perineal membrane. Now, on the perineal membrane superficially, here you can see this muscle which is placing on both the side is your superficial transverse perineal, and this is your urogenital triangle. So, in this triangle this muscle is placed posteriorly. Clear? Then you have the two more muscle, bulbo spongiosus and ischiocavernosus muscle. Now, these bulbo spongiosus and ischiocavernosus muscle covers the root of penis. So, they will cover the root of penis, and you know that penis root is having the bulb and crura. So, when you will see the roots of penis, this is your bulb which is covered by the bulbo spongiosus muscle, and these are the two cruras which are covered by the muscle is known as ischiocavernosus. Clear? So, now what is the crus of penis and clitoris? Now, see, most of the students are having the confusion between the three terms. What are these three terms? Corpora cavernosa, ischiocavernosus and crus of penis. So, these are the three terms which should be very clear in your mind whenever you are reading the muscles of superficial pouch. Now, before that you should have the basic idea about the structure of the penis, that in case we are talking about the penis, it is having the erectile tissue, and this erectile tissue is actually having the parts in the root of penis, and this root is composed of two parts, crura and the bulb. Now, the crura is a plural thing, and when you are using the singular we will use the word crus. Now, the cruras are divergent posterior part of the muscle which is known as corpora cavernosa. So, the first thing which you have to understand, that when you will have the penis, in the penis you have a paired muscle which is known as corpora cavernosa, and when you will see the corpora cavernosa, as it will go from the body to the posterior side, it will diverge into the two form, and these are known as crus of penis. So, there are continuity of the erectile tissue, and this continuity is your crus. Clear? So, there are two crus which are present in the shaft of the penis, and as soon as it will reach to the superficial pouch, they will diverge. So, what is crus? So, crus is nothing but it is a proximal most part of the corpora cavernosa, which is a erectile tissue. So, the crura are divergent posterior part of corpora cavernosa. So, there should be no confusion what is crus and what is corpora cavernosa. They are attached to the everted medial surface of the pubic arch and the adjacent part of the perineal membrane. So, whenever you are having the hip bone in your exam, you are having this differentiation between the male and female hip bone, and we used to always see for the everted margins of pubic arch. And why these everted margins are more prominent in males? Because of the attachment of the crus of penis. So, this is one of the very important point to understand when you are reading the differentiation in the male and female hip bone. Each crus is covered by and give attachment to the muscle, and that is known as ischiocavernosus. So, now there is one more term. Now, these crus of penis further covered by the spirally placed muscle, and that is known as ischiocavernosus. So, corpora cavernosa is a different thing, ischiocavernosus is a different thing. Ischiocavernosus is the muscle which covers only the crus of penis, and crus is the continuity of corpora cavernosa, and this is something which you have to keep in mind always. There should be no confusion about these three terms. So, at the distal end, the corpora cavernosa are inserted into the glans of the penis, which you can see that this corpora cavernosa will go and insert into the glans. Now, if you will see the male and female perineal pouch, you will find that in case of the male, you are having the bulb of penis which is covered by the pair of two muscles which are known as bulbo spongiosus. But when you will see the female perineum, you will find that in female perineum, the bulbo spongiosus muscles is split into the two half. There is no fusion between these two muscles, and this is one which we cut at the time of episiotomy in case of the female perineum. So, this muscle generally compromised at the time of episiotomy. Now, in this image, in this video clip, if you will see, this is the male perineum, and here you can see that this is your penile portion, and when you will go on the lower part, you can see that this is your urogenital triangle, this is your anal triangle. Now, in this side, you can see this green color perineal membrane, which we have removed on the opposite side. Now, superficial to this perineal membrane, you can see this is the perineal body, and it is providing attachment to the muscle on the posterior side of the triangle is known as superficial transversus perineum. Now, from above, you can see that there is a defect is present in your pelvic diaphragm, which is known as urogenital hiatus. And this urogenital hiatus is protected or supported or closed from below by here a septum like diaphragm, which is known as urogenital diaphragm, and the inferior layer of urogenital diaphragm is known as perineal membrane. Now, this is your crus of penis, which is covered by the muscle. Now, here you are not able to see the crus. Now, crus is visible once you will remove the muscle. So, this crus is a continuity of a erectile tissue which is present in the body of penis, and here you will have the posteriorly superficial transverse perineum. This is the bulb which is covered by the paired bulbo spongiosus muscle. So, here you have to understand that when we are talking about the muscles of superficial perineal pouch, you are talking about the muscles which lies below the perineal membrane. So, these are the area between the skin and the perineal membrane, and this is the crus of the penis, which is opposite side covered by the muscle is known as ischiocavernosus, and crus is a continuity of corpora ischiocavernosa. Now, we will talk about the muscles one by one. First is the ischiocavernosus. So, because whenever you are having the muscle, you have 4 questions always: origin, insertion, nerve supply and action. So, what is the origin of ischiocavernosus? So, as the name itself suggests, this arises from the ischium. That is why the word comes ischiocavernosus. Cavernosus word comes from its site of insertion, that is the crus, which is a part of corpora cavernosa. So, it arises from ischium, insert into the corpora cavernosa crus. So, the word comes ischiocavernosus. So, the medial surface of the ischial ramus behind the attachment of crus. Now, this is something important to understand, that this is the origin of your ischiocavernosus, and this origin is behind the crus. That means the crus will limit up to this posterior end. So, this behind the posterior end of the crus, you are having the origin and from the perineal membrane, which is adjacent to the muscle. Now, it insert by an aponeurosis into the crus, and crus is a part of corpora cavernosa. Now, what is the nerve supply? So, the muscles of superficial pouch supplied by the pudendal nerve, and what is the action of this ischiocavernosus? So, my dear friends, you have to understand that this is maintaining the erection of the penis, and how to maintain the erection? By compressing the deep vein. So, once you will compress the deep vein, the venous drainage of the penis is obstructed. So, once the venous sinuses are full of the blood, the erection will maintained, and this is what is the important action of the ischiocavernosus. It provides compression on the crus of the penis, and crus are having the impact on the erection. Now, the second muscle is the bulbospongiosus. Now, when we will talk about the bulbospongiosus, it is different in both sexes. I already told you the difference is that in case of the female, the urogenital diaphragm and the bulb of the vestibule are split. Now, they split into the 2 parts. Why? Because of the vestibule of the vagina. So, they are less well formed in the female as compared to the male, and it is always difficult to identify in the dissection of a female pelvis. In the female, the bulbospongiosus act as a sphincter of your vagina rather than it is having any action on the clitoris. So, when you will see this female perineum, you can find out that these are the 2 paired muscles which are on both the side of the vaginal canal, and they are known as bulbospongiosus. In male, these muscles cover the bulb of penis, and that is why it is known as bulbospongiosus, and the 2 muscles unite and they will form a single unit, and the line of their fusion is known as raphe. So, this is the raphe which is present on the in the males. So, what is the origin? Now, when you will talk about the origin, its main origin comes from the perineal body, plus also from the bulb of penis where you have the raphe. So, if you will remember my class of perineal body, we have already discussed that there are around 10 muscles, those are attached on this nodular structure in the perineum, which is known as perineal body. So, this perineal body is one of the site of the origin of the bulbospongiosus. Apart from that is the raphe. Now, what is the insertion of bulbospongiosus? So, the bulbospongiosus is divided into the 3 parts as per the insertion is concerned: anterior fibers, middle fibers and posterior fibers. Posterior fibers passes round the bulb to the perineal membrane. That means they are arising from here, they are making a loop and they will insert into the overlying perineal membrane. Then you will have middle fibers. The middle fibers are the largest fibers and they are bulkiest part of your muscle, and they encircle the corpus spongiosum. Now, this is again the important word. Now, you have to understand that the root of penis is having the bulb, it is having the crus, and they both are erectile tissue, and the erection of the penis is maintained by the supporting muscles which are known as ischiocavernosus and bulbospongiosus. So, you have to understand that the corpus spongiosum is also having very important role because its proximal end is known as bulb of penis. So, the fibers of Bulbo Spongiosus encircles the corpus spongiosum and unite on the dorsal fibrous expansion on the penis. So, on the dorsal surface of the penis you will find a fibrous extension, and that fibrous extension is receiving the muscles of your around the corpus spongiosum, and these muscle fibers are known as Bulbo Spongiosus. Now, when we will see the anterior-most fibers, the anterior-most fibers pass around the corpus spongiosum and the corresponding corpus cavernosus muscle to join on the dorsal surface. So, at the end you have to keep this thing in mind that origin is from the perineal body and the raphe. When we are talking about the insertion, you are having the two major places of the insertion. First, it is present, it will insert into the bulb, and second thing is they will insert on a dorsal fibrous expansion on the penis. Now, what is the nerve supply? As I already told you, all the muscles supplied by the pudendal nerve. Now, what is the action of Bulbo Spongiosus? Now, this is very commonly asked multiple choice or fill in the blank question in your exam, that which muscle responsible for the ejecting of last drop of the urine at the end of micturition, or last drop of the semen ejection after your ejaculation. In both the cases, the answer is Bulbo Spongiosus. So, the last drop of the urine in case of the males at the end of micturition eject with the help of this muscle is known as Bulbo Spongiosus. It assists in the erection by compressing the deep dorsal veins of the penis and contracts during the ejaculation. So, there are two important functions which you have to understand. The last drop at the end of your ejaculation or at the end of the micturition come out by the contraction of this muscle, and second thing is that this muscle also helpful in the erection. Now, what about the third group of muscle is superficial transversus perineal muscle. Now, as I already told you that this muscle is most posteriorly placed in superficial pouch, and it arises from the medial surface of the root of ischial ramus, that means on the medial side of ischial tuberosity. Now, here you can see that this is your ischial tuberosities, and on the medial side of the tuberosity you are having the origin of this muscle, and this is the point of the origin of superficial transversus perineal. Insertion, the insertion is very easy to understand. Here you can see that it is a horizontal muscle, it will go towards the midline and it insert into this body is known as perineal body. Now, nerve supply is the pudendal nerve. Now, what is the action of superficial transverse perineal muscle? So, it helps to study the central perineal tendon. So, first it will helpful to make the perineal body fix, and the second thing is that the posterior part of the perineal membrane is become fixed indirectly. So, when we are talking about the action of these superficially placed muscles, they are helpful in fixing the perineal body and though by your perineal membrane. So, now in this clip you can again see what is the placement of the crus. So, here you can see we have placed the two crus which are divergent part of your corpora cavernosa muscle. So, you can see that this is the corpus muscles. Now, on the posterior part if you will see, you will have the bulb which will come here, and this is your bulbo, this is your corpus spongiosum and corpus cavernosum. Now, here you can see that these are covered by the different fascias which are forming the different root of the penis, and here you can see that the crus are now covered by the ischiocavernosus, and this bulb of the penis is further covered by the bulbo spongiosus muscle. Clear? So, this is what you have to always keep in mind, that when we are talking about the perineal membrane, below the perineal membrane you are having the superficial pouch, and in superficial pouch posteriorly you will have this horizontally placed muscle is the superficial transverse perineal, and below that you will have this bulb which will go and fix posteriorly on the perineal body, and you will have these two muscles which are known as ischiocavernosus, which covers the crus of penis. Clear? So, here in this image you can see the nerve supply of all these muscles. Now, here you can see that this is your pudendal nerve, and this pudendal nerve enters through the lesser sciatic foramen, and then it will divide into the branches, and these branches are going to supply your bulbospongiosus, superficial transversus perineal, and ischiocavernosus muscle. So, at the end of this session, now I hope you are able to understand what are the names of the muscles of superficial perineal pouch. The most important thing is what is the difference between the crus of the penis and ischiocavernosus muscle, actions of all these three muscles, and the nerve supply of this area. So, this is all for this session. Thank you.